Hey everybody, Dr. Jeff here. I am a retired orthopedic surgeon that turned into a regenerative and functional medicine doctor. I've been practicing medicine for almost 30 years. Actually, today is my 63rd birthday, so I am an older guy. When I turned into a more holistic approach back in 2009, very shortly after that, I got sick myself. I got sick with Lyme disease. And then I started looking at that long-term effect. I was sick with Lyme disease for about 6 to 8 months. I was on oral antibiotics and then IV antibiotics, and finally my symptoms went away, but it took a long time. And so I started looking at the science on why some people would be treated with 2 to 3 weeks of antibiotics, their symptoms would resolve, and they would go out to live their life normally. And some people would develop chronic Lyme disease and be sick for years. And as we treated those patients, and I started treating some in my office along with my regenerative orthopedic patients, I realized that maybe we weren't treating a long-term infection. Maybe we were treating the results of the first infection. And then I got very interested in how we could go about doing that. I stopped doing that and really focused on PRP and stem cells for a long time, but then COVID hit. I developed COVID very early on. I was at a big functional medicine type meeting called A4M in Las Vegas in December. And then I developed some symptoms in January. Symptoms that were so bad that they lasted probably about 6 months. Cough, fatigue. I was really sick. At one point, I thought I was going to end up in the hospital. I contacted a functional medicine doctor friend of mine who is in Alabama, and we started talking about how to treat these long-term symptoms. And obviously things like ivermectin were working very well, but he came up with a theory, and then I started looking more into theory. I'm a research guy, so I started reading everything I could. And what we figured out was people that developed COVID and then went on to be really sick, like hospital, ventilators, ECMO, and sometimes terminal events, they were dealing with what we refer to as cytokine storm in their lungs. And that cytokine storm would bring fluid into their lungs, which would turn into mucus, which would get thick, cause them not to be able to breathe, and end up on ventilators and ECMO. We figured if we could stop the cytokine storm, then we could make these people better. And what he started doing, because he was practicing true functional medicine, I was doing more orthopedic stuff. He started using a drug called Lamictal. Lamictal is an antipsychotic drug that is used mostly for schizophrenia. And what he was looking at was Lamictal is known to decrease cytokine storm in the brain to get rid of those mental health psychiatric symptoms. But if he could use that same drug to get rid of cytokine storm in the lungs, he could save people's life. And he started doing that. Now, Lamictal has a lot of really bad side effects. Liver disease, something called Stevens-Johnson syndrome, where you get bad blisters and stuff on your skin. So horrible side effects. So I never thought that was something that I would want to do or recommend to a patient. So I looked at what else can cause a decrease in cytokine storm, and I came up with a theory. But here's the thing, is I think chronic Lyme disease, I think we treat the Lyme disease and then people have long-lasting infections from chronic cytokine storm. I think we're seeing the same thing in COVID. People get COVID. Most people are over it. I think almost everyone is over it within 2 to 3 weeks of either treating it or just letting it run its course. But some people have these long-term symptoms, long haul COVID. And I think, once again, it's this long-lasting cytokine storm, which leads to long-lasting inflammation, which leads to long-lasting sickness. So if we can treat the cytokine storm, then we can treat the symptoms. So I started talking to friends. Like I said, I don't practice anymore. I'm more in the research and consulting and teaching side. But I started talking to friends that were dealing with this and struggling with long-term COVID symptoms. And I recommended this treatment, and they started using it, and they started seeing improvement. I always wondered on how I could get this out to more people. And then I thought about Facebook. There's a lot of Facebook groups that follow these different diseases. A lot of people are looking for help. So I thought I would make this video, and I would make the research that I have available to people. So if you're interested in getting the research, just comment STORM to this video, and I will send you my written research. If you're going to ask, why don't I just post it online? It's because I don't want to give out medical advice online. So if I give it out to you personally, it's not available for the public to see. And that way I can deal with who's seeing it and who's not. So if you're interested, comment Storm and I'll send you my research. Hope that we can get you well and hope you have a wonderful day and a wonderful week. Bye-bye.